Hi everyone, I'm here to teach you about the do's and don'ts of pre and postnatal Pilates. But first, I just want to talk about why Pilates is such a good choice of exercise for someone who is pregnant or postpartum. Prenatal Pilates is a great form of exercise. In 2017, actually, there was a study saying how beneficial Pilates is for new mothers' mental health and also to decrease any aches and pains that come along with pregnancy throughout the way. When you are pregnant, your center of gravity starts to change with the growing baby. So with practicing Pilates movements, it will very much benefit your clients' postural habits and also their body awareness during this time of their body constantly changing. Staying mobile throughout the spine and body throughout pregnancy is very important, and with Pilates, there's a lot of movements with the spine. You will move your spine in flexion, extension, lateral flexion, and rotation. Good spinal mobility can help prevent all types of discomfort during pregnancy and postpartum. During pregnancy, as your uterus starts to expand, your body starts to be working more with the front of your body, so anteriorly. With that, your glutes and hamstrings begin to lengthen, which in turn starts to weaken then. So a good way to help your clients during their pregnancy is to work on strengthening their glutes, which will in turn strengthen their posterior chain, which is the back of their body, where they will need some extra support since they do grow from the front. But with pregnancy, there are so many changes happening to your client's body at all times. It's most important just to keep clear communication with them and see what they're feeling and what they need, and giving them as much help and support that they will need. Do not have your clients exercise if not approved by a doctor first, and if they have any of these following conditions, which would be preeclampsia and eclampsia, premature rupture of the membrane, placentia previa, premature labor, competent cervix. We're going to start with the do's and don'ts of the first trimester. So our first do is going to be talk and communicate with your client, set up a game plan for them, and let them know that you are here to support them in any way. My second do is going to be teach engagement of the pelvic floor exercises. This will benefit your pregnant clients in a lot of different ways. The first way, it will help teach them how to properly push in their second stage of labor, which in turn can prevent any muscle damages or even small tears. Another reason is that it will strengthen the muscles that support the uterus of the growing baby. So those type of exercises will be very beneficial for your clients. Now we're going to move on to don'ts. Our first don't is do not have your client lay prone on your stomach throughout any point of the pregnancy. Our next don't is don't lock out your joints. During your first trimester, your blood pressure rises, and you want to remind your clients to not be locking out their joints. Our last don't is don't let your clients lay supine for any longer than 10 minutes and have them inclined on a wedge or a Bosu ball. The growing uterus can compress the vena cava vein, which brings the blood flow to the baby, so you never want your client laying longer than 10 minutes. Okay, now we're moving on to our second trimester do's and don'ts. So for do's, remind your clients to take breaks whenever needed. Another do I would have is do more side laying work and also unilateral work. Just remember to always switch sides if you're cueing your clients differently than the rest of the class. Do limit and modify open chain exercises with the legs up in the air. The last do for the second trimester is when they are no longer able to do the tabletop positions, which typically can be around the 5 to 6 month mark, you can move them down to the floor to do their supine arm work with the springboard. Now we're going to move on to our don'ts. So our first don't, again, is do not have your clients lie supine for more than 10 minutes. It's very, very important in the second and third trimester to not have them do that. They need to be having a wedge cushion underneath them to give them a supine incline position, or you can even use the Bosu bar or jump board if needed. Don't is do not have your pregnant client stand on a reformer in any way. That is a fall liability, so have them do any modified work on the floor, like floor lunges or fencing lunges with gliders, anything like that. And our last don't for the second trimester is, again, do not have your clients lay prone on their stomach. The uterus is growing, and that is not good for pregnant clients. We're just going to keep it going and move to the third trimester do's and don'ts. So the first do is make sure to help modify your clients when needed. At this stage, the baby is growing very rapidly, so a lot of extra weight is getting put on the mother. So make sure you are just giving them the modifications that they need and staying up to check with them. The second do is to just encourage your clients to keep going. The third trimester is so exhausting for pregnant women, so just a little encouragement can go a long way. That's probably what they need at that time. You can also encourage your pregnant clients to limit their range of motion. And then my last do is to, again, keep constant communication. I feel like this is the number one thing with pregnant clients because all pregnancies are different and each client is going to need something else. So clear and constant communication, especially in the third trimester. You want to know how your client's feeling at all times. Now we're going to move on to our don'ts, which is a little repetitive because it's the same as the second, which is do not lay supine without an incline. At this point in the pregnancy, your client probably won't be that comfortable laying supine at all, so you can move supine work to quadruped work or side laying, anything to make them more comfortable, because lying supine just probably won't be comfortable for them at this point. Our last don't is do not lay prone, which again would not be comfortable for a client who is pregnant, especially in the third trimester or at all. Okay, now we are going to move on to postnatal. So after birth, women's abdominals and pelvic floor are very stretched out. So you want to be very careful with exercises that involve core stability, but at the same time, you are going to want to help your clients build their core back up just in a careful manner. So you want to focus on transversus abdominal work and also strengthening and stretching the inner thighs and pelvic floor will be great exercises to ease your postpartum client back into Pilates. You just want to be careful about inversions and overstretching. Like I said, you need to communicate with your client and see what feels good to them, especially postpartum. And that is going to be the end of the do's and don'ts of pre and postnatal. I hope you guys got some useful information out of this. Now I'm going to move on to showing you guys the modifications.